Sounds good. Absolutely. So as Kobe mentioned, I did live here for 5 years. It's nice to be back. I missed that southern drawl. You don't hear that in California very often. Wonderful. Well, I'm going to talk first about best practices for man training. And this presentation was really created as a way to parallel what Dr. LeBlanc spoke about this morning in terms of ensuring appropriate stimulus control when you're teaching Mands and all those little intricacies that go along with how to teach a Mand and what can go wrong and how to fix it if it does go wrong and how to program right from the beginning to ensure appropriate stimulus control and to ensure that your Mand training is successful. Those of you who are doing this kind of work, I'm sure you've had experiences where something has gone awry, and my guess is there was something about the programming that you probably could have tweaked to ensure that didn't happen. And so that's my goal today, is to give you that information and ensure that we have a lot of guys and gals out there talking up a storm. Okay, great. So as many of us know, language intervention is really the centerpiece of a lot of habilitative programs. And most of you who are working with children with autism also in these types of programs know that language deficits are a core feature of that diagnosis. It's one of the most commonly reported things that families are struggling with and wanting us to address. My child's not talking, or they're talking in such a way that it's not making sense, or the structure is off. And so we deal with it quite a bit. And it's one of, also, those of you working with other diagnoses, it's one of the frequently associated behavioral deficits with individuals with mental retardation. And so language intervention programs are really diverse. They're categorized and organized in a lot of different ways. I'm going to talk a little bit about those ways, and I'm going to give you a little bit of background on verbal behavior. I won't go into too much detail because I'm guessing that this is a group that's skilled in that taxonomy, but I'll give you just a little background and talk a little bit about how sometimes language programs, even within the field of behavior analysis, can be organized in such a way that is not very behavior analytic, or it can sort of be this combination of the two, and how we might look at building those programs and thinking about language in such a way that ensures that we're teaching under the right stimulus control, in particular in relation to the Mand and the Mand repertoire. Okay, great. So I want to do just a little background. I like talking about the theories of language because I think it helps to contextualize verbal behavior and then also sets us up to have a more sophisticated discussion around demanding. So this may be a review for some of you, but stick with me. If you're working with people from other disciplines, commonly, or if you are a person from one of those other disciplines, speech-language pathology, behavior analysis, there are different theories of language, and usually people's programming will build from those different theories. And so these are three of the most common ones. The first is that language is biological, so it's a function of some physiological process and function, and that really language is inherent. So when a person is born, they're born with language and the ability to engage in language, and that sort of comes with birth. That's one interpretation. Another theory of language is that it's cognitive, so it's controlled by an internal processing system. You may have had some schooling and some education or learning about Chomsky and the language acquisition device. Does that sound familiar to you? There was this acquisition device that really was responsible for language and controlled language and whether an individual engaged in it or not. But essentially it was really just language is just a cognitive process. Finally, and this will bring joy to your hearts, is an environmental perspective, which is what verbal behavior has come out of, what Skinner, his theory involved, and really that's that language is learned, and that we extend language, we acquire it through our environment and through environmental variables. That's a really cool theory to be a part of, right? Because then now we have a situation where language is controlled by things that aren't necessarily inside our skin, and we have access to them. So whenever I talk to parents about this, I talk about that, and I talk about, gosh, this is really a powerful thing. It's a powerful thing to be able to think about language and think about the fact that we have control over the environment, and we can change the environment in such a way to make language more or less likely to occur. And that's the behavior analytic account, and that's where verbal behavior comes from, and what we'll talk about today, and then in the context of man training. Great. Okay, so let's talk a little bit. There's a couple of different ways that language programs can be categorized. Some of you may be thinking about them in this way. Language can be classified by form. So what it looks like, right? So receptive labels, expressive labels, asking questions. These might be programs that you've seen before, you've even created. You can also have language programs that are classified according to content. So things like functions, emotions, categories, prepositions. Those are okay titles, but as we'll talk about here in a moment when we talk about verbal behavior, they don't tell us a ton about what exactly that verbal behavior repertoire looks like, right? So if I just say we're going to teach emotions, I'm sure you can think in your mind a number of different ways the responding could look from the child if you're going to teach emotions, right? So they could, as a listener, respond to that and show happy on their face. They could tact or label somebody's happy expression. They could answer a question, how do you feel when you are in Atlanta, happy? That was a good intraverbal there. They could choose, they could make a selection out of an array. So maybe I have all sorts of different pictures on the table, and I say, point to the person who's happy. That's a common, right? And so categorizing language that way is not all that helpful. And what I'm going to talk to you about is a functional classification of language. So great if we're teaching emotions, but let's talk a little bit about what that looks like, and what operant, and what are the specific antecedents and the specific consequences controlling that responding, and what are we really trying to get at. Does that make sense? Yeah? Good. I'm glad you guys are here. If there was not an empty room, I would need to have something on the wall to talk to, or smile and nod. Good. So my vote, you were collecting votes, right? My vote is to keep people in the room, for sure. No empty room, yeah. At least, that's right. Write the questions for them, and I like that. Good. It is a little less intimidating, though, knowing that the 90 people are elsewhere. You can't see them, and it's a much more manageable group here. That's right. I'm sure they all are. Give you a virtual smile and nod out there. All right, good. So that's a real nice segue, and I just want to give you a little introduction, because I think it really fuels. If you don't have this context, it's a little difficult to talk about Mands and man training and the nuances of what we're going to get into in terms of setting up your programming so that it's optimally successful. In 1957, Skinner proposed an analysis, and it's primarily based on the controlling variables. And that's what I want you to keep in mind when we talk about Mands today, that what's controlling the response, stimulus control. That's a huge issue. That's what Dr. LeBlanc talked about all morning. And that's really where things can get funky, when you start to get odd stimulus control or responding that's happening in the context of multiple stimuli. But essentially, Skinner's verbal behavior was a comprehensive approach to language derived from learning principles, and it really looked at function instead of form or content. Talked about the primary unit of analysis being the verbal operant, and in that looking at the controlling antecedent. So what is the thing that's controlling the response, what's happening right before it occurs, and what are the maintaining consequences. And that varies depending on the operant that we're talking about, and I'll get into that as well here. Okay, so just some main points to keep in mind. Skinner really talked about language occurring under certain conditions and not others. This is one of my favorite examples. It's a commonly used example, but when was the last time you were driving in your car and you ordered a cup of coffee? Probably not ever. And that's because that's a certain condition under which that verbal behavior will not be reinforced. The antecedents aren't present. The person is not there. A menu is not there to take your request and reinforce it. And so you engage in behavior under those certain conditions. You're highly likely to walk into Starbucks and engage in that kind of demanding behavior for a cup of coffee. So language happens under certain conditions under which they've been reinforced. A vocabulary is something you use, not something that you have. So sort of, again, getting away from that idea of language being internal or something that we are born with that we have, but something that we use to have an influence on the listeners around us and to have an influence on our environment, right? You want that cup of coffee, you ask for it, you get it. That's something I use to impact my environment in such a way and to receive that reinforcement. A word's definition and meaning depends on the context in which you say it. So much like giving that example of talking about emotions, the happy response really depends on how I say that happy response. And we'll get into the nitty-gritty here in a moment, but that's an important take-home point that depending on how I'm using the word will really define it for us. Okay, and then language is learned behavior like all other behavior, which again I think is an exciting perspective to come from and something that's neat to think about and gives us a lot of great stuff we can do with the environment to ensure that our children and individuals with autism, other developmental disabilities are speaking and using their vocabulary. Okay, so one thing I want to talk briefly about that I think is really important is that the early verbal operants in particular can be functionally independent of other operants. And so what that means is teaching a tact repertoire, I'll talk about what a tact is in a moment if you don't know, doesn't necessarily mean that child is going to be able to engage in those same responses as a listener or in Mand form. So I'm sure, I know I've met a number of children for whom they can label, tell you everything in a room, a chair, laptop, coffee, water, but they can't ask for those same things. And it's because there's different antecedents and different consequences for those responses. So if you're not yet thinking in this way, think in this way, that the verbal operants are functionally independent, and so they're not going to cross over. So if I teach a kid a bunch of tacts and a bunch of listener or receptive and expressive programs, I'm not necessarily going to get a Mand. I'm not necessarily going to get an intraverbal response. So that's important to think about. You really probably have to focus on teaching important operands under the right conditions and not assume that transfer. So I'll go into the early verbal operants. I'll talk primarily about, again, just an orientation, the Mand, the tact, the intraverbal, and the echoic today. Talk a little bit about listener language, and then we will get into talking about Mand specifically. But don't assume that transfer. Don't assume that transfer, right? Well, he's doing it as he can label all of that. He's certainly going to be able to ask for it. They're functionally independent and should be treated as such. Look at that cute baby. Everybody has to have a cute baby in their presentation, right? That makes everything so much better. I don't know whose cute baby. It's not my cute baby. I don't know whose cute baby it is. Somebody on the internet. Good. So I want to talk a little bit about motivating operations because it's going to be key when we talk about the Mand. Motivating operations have a value-altering effect and a behavior-altering effect. And so these are stimuli in the environment that change the value of something and change any behavior that's produced that item in the past. So you guys have probably heard this common example. It's very normal to be used in the context of this discussion. But if you're hungry, you haven't had something to eat, so right before you all went to lunch, you probably found that little gurgle in your tummy. The value of food is really, really high. And so you're willing to engage in behaviors that have produced food in the past, right? So we're going to drive down to Zoe's. Zoe's is very delicious. Any of you that are in Atlanta next time, you should go to Zoe's for lunch. You're willing to drive there, pay your money, get your food, because the value of food is very high, and that behavior has produced food in the past, so I'm more willing to engage in it. That's a very important concept to think about when we think about Mands, because, and I'm jumping the gun a little bit because I'm excited, but the antecedent to a Mand is the motivation. That's the thing that should be happening first, and the only thing that should be happening when we talk about pure true Mands. So we'll get into how you make that happen, but it's extremely important. It's the only verbal operant that does that. The other verbal operants have different antecedents associated with them. The Mand is controlled by the motivating operation, so that's important. Okay, so let's take a look at, I have just a couple of grids here to walk you through the antecedents, the behavior, and the consequence for those elementary verbal operants. So let's talk a little bit about the antecedent then, again. So let's say I really have motivation to obtain a guitar, really looking to play that guitar, excited about it, that's the antecedent. The behavior is in the form of a request, so I ask for the guitar. And the consequence is specific to my request and my motivation. So that's important as well, that it's not just oh, good job, you asked for a guitar. You ever see that in some of your man training programs? Good job asking, but I didn't actually get it. It's a terrible consequence for a man. You walk up to that Starbucks lady, can I have a latte? Good job asking for your latte, and then it never comes. Great way to completely decrease manding behavior. Anyway, so the consequence is specific in the form of a guitar. Okay, let's talk a little bit about the echoic. Again, this will come in real handy when we talk about training procedures, because I see a lot of programs that are Mand training programs where the source of stimulus control is really it's an echoic. So there's these vocal verbal prompts embedded in, and the child is echoing, and it's difficult to detect, but it does happen. But this is probably not new information to you, but the antecedent is a vocal verbal stimulus guitar. Behavior is in the form of the same echoed verbal stimulus, and the consequences, that's your general. You're right, that is a guitar. Good job. Okay, the tact, again, this is going to be important. And the antecedent to attack is a nonverbal stimulus. So that could be anything. That could be a sound, that could be a smell, that could be a picture, that could be an object, any nonverbal stimulus. So in this case, it's a guitar. The behavior is in the form of what we think of as a label. So this is what a lot of people will classify as an expressive language, expressive label program. And then the consequence is just generalized social reinforcement. So you're right, that is a guitar. Okay, and then I'll talk about the intraverbal. So this is oftentimes, if you've seen programs that are sort of related to question asking, something along those lines, usually people are talking about intraverbal behavior. So you might have an antecedent, a verbal stimulus, for example, name an instrument that has 6 strings. The behavior is in the form of a guitar, doesn't match, so it's not an echoic. I didn't echo back, name an instrument that has 6 strings, although that happens, a different issue, different training. And the consequence is just some generalized social reinforcement. Yeah, that's right, good job. Okay, good, and then the listener response, which Dr. LeBlanc mentioned and spoke all this morning about, and you'll typically see antecedent, show me the guitar, and array. Look, they're stacked up to avoid that side bias. I like that. The behavior is in the form of not a vocal response, touching the guitar, and the consequence, again, is just that generalized social reinforcement. You're right, that's it, way to go. Or no, no, that was one of our consequences already, right? Okay, great. And so the meaning of a word really depends on the context in which our learners use it or you use it. So we can have the word guitar, but depending on how I use that is going to change the quote-unquote meaning. So if I say guitar and the child says guitar and I say great job, that's an echoic. If I say show me the guitar, child points to it, we've got listener language. If I say, hold the guitar up, and the child labels it and says guitar, and I say, yeah, good job, we've got a tact. And if I say, without the guitar present, what's an instrument that has 6 strings? Child says guitar. I say, awesome, I love guitars too. That is an intraverbal. We're going to focus on the Mand, and the antecedent being that I'm motivated to obtain the guitar, I want the guitar, I engage in a request, and I receive the guitar. Okay, that's a little light. Can you see that okay? Yeah? Okay, so I brought this table up just because I wanted you to see the various verbal operants. Again, we're not talking about textual and transcription today, but Mand, tact, echoic, and intraverbal, the antecedents and the consequences. And the main thing I want to point out is that the only operant whose antecedent is the motivating operation is the mand, and the only operant that does not have that general social praise as a reinforcer is the mand. And so that's why it's very important. There's a lot of power in that, and I'll talk about why in a moment, but very important to think about those particular antecedents and consequences and how they differ from the other operants, and why they're so important to teach first, and why it's so important to attend to these particular teaching procedures to ensure you have appropriate antecedent control, and the consequences are delivered appropriately. Okay, great. So this is the fun part. Good. I'm not monitoring my questions, but you'll let me know. There's no questions so far. Yeah. Okay.
That was one of the new slides, right? That one's not in the...
Oh, it was not one of my new ones. I don't think. I think this one has been in. Oh wait. Oh, the last one. Yes. I'm sorry. I thought you were talking about this next one. Yes, that was one of the new ones.
Will
So.
you just tell everybody that I'll update?
I will. So that is about, there were only 1 or 2 of those, so the rest of it you should be perfectly good to go with, yeah. Good. All right, excellent. So I will be honest, I've never conceptualized mand training in this way before, but in prepping for this talk and speaking with Dr. LeBlanc, it's a cool way to conceptualize it, and I think it breaks down the process of mand training into phases that makes them a little bit more palatable, and also gets you thinking about all the things you have to do to ensure good, solid teaching procedures. And so I'm going to talk a little bit about the planning phase. And then I'm going to talk about the actual training phase, so what we're doing when we're actually teaching. And then I'll talk about the maintenance phase. And the one thing I want to emphasize and for you to think about is that these are really interconnected phases. So the work that you do in planning your mand training, the work that you do in preparing for the training phase is really going to influence how that training phase goes, and is really going to influence the maintenance phase, and vice versa. So the work I do in the training phase is going to really influence the maintenance phase. And so working through your mand training procedures and planning and programming in this way is going to really ensure that you train the mand repertoire, and then also can then use those phases to train other operants as well, like the tacts and intraverbals. So pretty grid, think about it in that way as we're going through. Okay, so let's talk a little bit about the planning phase. I'm going to talk about a number of things, and I'm going to break this down and talk about each one individually and have some time focused on what each means and what the training procedures look like. But we'll talk about the planning phase, a couple of things to really keep in mind. We want to target Mands first, and I'll talk about why that's important here in a moment. I'll talk about conducting preference assessments, the importance of those, what they look like, how they fuel your programming and help you plan. I'll talk a little bit about choosing a modality, but I don't want to give too much of my next presentation away because I'm going to present a research study on looking at how you choose a modality like sign language or pictures or vocal responses appropriately. And then I'll talk about targets and items and how to look at those. We'll talk a little bit about sequencing and ensuring the sequence is correct, setting up the environment. Okay, so it's really important to target Mands first. I need your exclamation points, those many that they need to be on here. I don't know if I have any, but if I could emphasize this enough, I don't want to say it makes me angry because I never really get angry, but when I go into I look at a program and there's a little guy or gal and they've got all this sophisticated language, but there's no mand training happening, it breaks my heart a little bit. So in putting this together, I was thinking, oh gosh, this is stuff that's happening, but it might not be happening as much as we think it is, but it's real important for it to happen. So if you take nothing else away from this presentation, please take home that kids need to be manding, and that needs to be the first thing you teach. And there's a lot of reasons for that. One is that it directly benefits the speaker, right? So when I say, say cookie, and a child says cookie, and I say good job, they get a good job. But when a child says cookie and they want a cookie and they're motivated for a cookie and they get a cookie, that is powerful stuff, right? That teaches a child, wow, these big people running around are really amazing. They can get me things. Those things are valuable. And this talking thing is not too hard. And it accesses really good things in my environment that I want. And you can decrease a lot of problem behavior that way, or even prevent it from happening in the first place. And that's very different than teaching tax and echoics, where that consequence is just, hey, way to go, which kid may or may not, that may or may not function as a reinforcer for our kiddos. Okay, the other thing is that if you use appropriate stimulus control transfer procedures, you can have Mands that transfer to tax, which can transfer to intraverbals. So again, thinking about that planning, training, and maintenance phase, a little bit of the work that you're doing in just preparing and teaching Mands is going to set you up to have a real successful program in the other operants like tax and echoics, because you can use some transfer of stimulus control procedures to teach those other operants, right? So if I teach a child to Mand for cookie, and then later in the presence of a picture of a cookie or a cookie, the child then labels it, now I've got a tact, and you can embed those types of transfer stimulus control procedures into your teaching. Okay. Another reason why it's really important to teach Mands first is that, again, those EOs are often powerful, and you can get rapid acquisition. So I'm sure some of you have been in this situation before, where it's the best day of the job, right? When you sit down with a new learner, and within 5, 6, 7 trials, you're starting to get independent Mands. It's just amazing, and that's real powerful, and you can get nice quick acquisition that way. Okay, and I was ahead of myself. The Mand ruptor can lead to transfer ruptors. If you use stimulus transfer procedures, we won't talk about a ton about that today, but I can certainly answer questions, and we can talk about it a little bit later. Okay. So the next one is important to do a preference assessment. This has been one of the most common things I've recommended in problem solving, in working with folks, is that people are trying to teach Mands for things that the child is not motivated for. And a lot of that is because a preference assessment hasn't been conducted. I know it seems real simple, but I remember observing a program once, and it was a Manding program, and the therapist is kind of chasing this kid around, like, ask for the bubbles, you want the bubbles. The child's running away. It's very clear that the child does not want the bubbles. But if you're not thinking about the Mand in that way, that it's really controlled by that motivation, then you got a therapist running around chasing a kid trying to make him ask for the bubbles. They might Mand, but probably not for the bubbles. Probably to get you to leave him alone. So anyway, conduct preference assessments. I mean, there's a variety of ones you can choose from, but conduct them and allow them to fuel your programming decisions. So this is just a sample of a paired stimulus preference assessment. I like to use this one because I always like to try and figure out a way I can work the words pirate booty into my presentation, which is just an edible snack item for a child. So you just have the items along the x-axis there, and then the percentage of selection along the y. And you can see if I were to have started with apple here, I probably would not have the same kind of responding in trying to teach a Mand as I would if I went with raisin or strawberry or pirate booty. Good. All right. Great. So certainly there's a big decision that goes into Mand training and choosing a modality. And again, I'm probably just marketing for the next presentation because we're going to go into this in great detail. But this is a hot topic, and I know a lot of people have really strong feelings about sign or pictures or vocal, and when do you choose which? And to be honest, there's not a lot of literature guiding that decision. A lot of it is based on our own histories of reinforcement for choosing different modalities, but we are conducting some research at Trumpet Behavioral Health to investigate the way that you might choose a modality based on prerequisite skills and the child's responding. And so it's some real exciting data that I'll share with you later this afternoon. But these are some of the most common ones. I know that there are others out there. There's technology and all sorts of other modalities that can be utilized, but vocal, sign language, and then some sort of picture exchange or picture system is pretty commonly chosen as well. Okay. Great. So I want to spend a little bit of time, we're in that planning phase. I want to talk a little bit about choosing appropriate targets and items. This is another thing that can cause your teaching procedures to go a little funky if you are not choosing items that are going to be able to be delivered effectively and on multiple occasions. So I'll talk briefly about that. Things that are consumable are good for many of the reasons that you're probably thinking about in your head. You know, I eat a Skittle and it goes away. I don't have to then go and get the Skittle and bring it back and, you know, engage in some tug of war. And so now I become the person who not just gives things but takes things away. Get a little bit aversive, but Skittles are nice. Any edible is nice. Pirate Booty, Skittles, whatever you like. Things that have a short duration, so bubbles are a good example of that, something that you can sort of have and then it goes away, and the learner sort of has to come back to you to get more of that, right? Other really good first targets and items are things that are easy to remove. As I mentioned, getting into that sort of tug of war, we're going to go back and forth and grab that thing from you and then give it back, can be funky. I've watched people do that where there's things, you know, around the room and the child goes and goes to grab for it and they jump in and grab it away and say, oh, you want to ask for that? But something that's easy to remove, you know, the brief little clips of videos or shows or music that a child likes to listen to, you can play that for a moment, you know, hit the pause, get another Mand, hit the play again. It's very helpful. And then things that are easy to deliver. So I'm sure you guys have all had this, but you know, kiddos who really like having lots of an item. So for example, blocks or trains to go on a train track, and maybe you're delivering those blocks such that they're building a huge tower, or different pieces of a track such that they've got their track together. Things that are easy to deliver in that way, as opposed to something like a bike or the swimming pool. That's a very effective Mand, but it's sort of a one-time, you know, and you might have some logistics involved in the delivery, of course, too. We'll drive to the swimming pool and 30 minutes later get there and you'll get it. Okay, and then things that can be delivered on multiple occasions. So things like drinks, oftentimes, I'm sure y'all have done this before too, but you know, you might take some juice and put a little bit in a cup, child drinks it, put a little bit more, a little bit more, a little bit more, as opposed to here's the whole juice box and you just drink it down. Because as we'll talk about, we want lots and lots and lots of Mands in that early repertoire, right? We want to have kids who are asking for things and receiving them very, very, very frequently. When you think about typically developing children, this is what they're doing all day long, right? Those of you who have kids or around kids a lot, they're manding. They're asking for things. Can we do this? I want this. I want this. Give me this. Give me this. Give me this. Give me this. And we want to match that, and we want to have those numbers be high and really get the child receiving things from their environment very, very frequently to have the most power. Yeah? Oh, good. Okay. How do I do this? All I have are the slides for the presentation. That's the last one I have.
Well, I'll just read them to you.
Okay, great. We're going to stop and ask some questions.
Yeah.
That's great.
Okay, so, and I'll just read it so you can.
Okay.
So the first one is, I'm assuming this, start with, include, and emphasize Mand training, is just as true for adults with disabilities as it is for children with autism, correct?
Yes, absolutely. And I apologize. I should be talking about that as well. I should be talking about different populations. But yes, regardless of age, regardless of diagnosis, you know, if an individual does not have the ability to ask for the things in their environment that are meaningful and that they're motivated for, you absolutely should be teaching them to ask for those things. And so you can get into some interesting discussions around you know, working with older consumers and whether you know, you should be using a VB map to guide your curriculum or whatnot, but that's not, those points are sort of moot. The idea that a person doesn't have a way to ask for the things that they want is really the key variable, and that person could be 65 or that person could be 18 months old. So yes, definitely. And you know, the kinds of things that you teach might be different because the motivation may be different. So you may have an adult who is motivated by different things than a child is motivated for, but again, not related to age or or diagnosis.
Okay, good.
Great.
Would you ever exclude a target from manding because it's too difficult to remove? For example, the child throws a nutty when you do.
Throws a nutty? Is
A
that
nutty, yes.
A nutty?
That's
Is this
colloquial
a Southern? What's a
for
nutty? Is
aggression,
the Southern
screaming.
language evolved in the 2 years I've been away? Pitch a fit.
Yeah. Throws
Well.
a nutty, yeah.
Yeah, maybe. If the child has other equally preferred things and it's this one thing that's causing these troubles, maybe I might, and focus on the things that are not as difficult to remove. But if I have, that's really the powerful thing, then I would work with it. And sometimes man training is the answer to that. Like you have this kid engages in tons of problem behavior because you're removing something, but you quickly teach them to ask for it back, and you see responding shift, because now it's really easy for me to access that thing back, and I don't have to throw this tantrum, and it's not a big deal. So it probably depends on the child and their motivation, and if there are other equally motivating things, but sometimes man training can be the fix for that too.
Yeah, good.
Yeah.
What about access to self-stimulatory behavior as a man target?
Well, that is an interesting topic. You could probably talk for a while about that. I would probably not start there. I would probably start with other things first. It wouldn't be my first mand, and I think this is probably a topic that there's a lot of discussion and controversy around, and
the difficulty in restricting
thank you.
the difficulty in restricting access to the preferred item can mean that essentially there's not really a contingency. I can do my stereotopy whenever, whether I have asked for it or not.
Yeah.
And so there's no differential outcome of asking to be able to engage in my stereotopy. And depending on what the kind of stereotopy is, it may introduce a lot of, I'm going to physically manage you and get in your space and not let you behave in a certain way, which can introduce coercion into the interaction. So you don't want to start off with that kind of a pattern.
And then also, it's something that's, thank you, difficult to restrict, right? And so that's a big part of man training, is creating some period of deprivation, but unless you're with the child all the time and blocking that response, they have free access to it, so you may not have as powerful of an MO to start that as a first man.
All right, one more.
Okay, these are great questions.
So don't
Thank
throw a
you.
nutty. Not sure if you will cover this, but do you have good recommendations or research for extinguishing scrolling during manding?
We are going to talk about that. Yes, we're going to
Okay.
talk about that at the end when we talk about
Very
problem
apropos
solving.
question.
That's great,
And
great.
you wanna fix your thing while you talk.
Fix my thing. Okay.
So the question is-
Oh yeah. Okay. Very good.
Yeah,
Very
like,
good.
whoa,
And how
fixing anything.
how am I on
Stay right there.
how am I on time? If I need to go a little past that 2:45 mark, is that okay? Yes.
What? Are you serious?
I'm kidding. There's gonna be throwing some nutties out there. Don't throw a nutty in Japan. We don't want anybody throwing a nutty in Japan in the middle of the night. Middle of the night nutty. Okay, great. So let me talk a little bit about choosing appropriate targets and items. So it's really important to choose things that are specific and tangible. And the reason is because the presence of the item when you're starting man training can really serve as an SD, or discriminative stimulus, for manding behavior, and that can be very helpful and powerful. So all the things we've been talking about, Skittles, juice, car are good. I try and stay, I want to talk about this in a moment, but I try and stay away from the more general categories. So many of you have probably been in circumstances where something like more has been taught, or eat. And the reason it's important to stay away from things like that is because it can create a blocking effect. Such that you can't you can't teach the child more specific topographies. So you get this communication that really works for everything. So when I do this, I access, drink, I do this, I get my cookie, I do this, I get my mom, all these kinds of things. And then you later have a really difficult time building the Mand repertoire and teaching more because it works for everything. The other thing is that it creates a communication that is very difficult for a listener to respond to. So I have been in situations where I've had these just, adorable children, looking up at me and doing the perfect little more sign, and I have no idea what they want. I've got, 15 things around me. They actually haven't had anything to begin with, so it really more isn't quite that accurate anyway, because they haven't had it to begin with to get more of it. And so I'm just going through the laundry list of things as they're manding to figure out what they want. And so it creates a situation that it's real difficult for the listener to respond, and then you start to get some problem behavior, the nutties start to happen, the pitch and a fit starts to happen, because as a listener, I can't respond to your man. I don't know what you want. So stay away from that. Avoid social niceties. So, there's that common saying that we'll teach them to talk first and how to be nice later. And really things like please, when you think about that as a first Mand, it's the same type of thing as that more category. We have a kid going around saying please, but can't quite figure out what it is they want. You get this blocking effect where then it becomes more and more difficult to teach additional Mands and to increase the topography. Thank you is kind of wonky when you think about what stimulus control and things like that for a Mand. If I'm getting a kid to say thank you, usually that happens after the thing is delivered, and so there's no motivation present for it anyway, right? I've already received the item, so it really just becomes an arbitrary response that you teach after the delivery of a reinforcing item. So don't teach your kids to be nice at all. Not necessary. And then at least in the first, the initial acquisition stages, try and avoid things that are negative reinforcers. So if I don't like to get a kid as their first way to communicate and have an impact on their environment to teach them that we're all done and I'm going to go away, or I'm going to stop doing the things that we were doing. It's not that you can't do that. I mean, you can teach it and probably teach it pretty effectively, but then you have a situation where the child is just engaging in a behavior to get you to leave them alone, and that's not fun, right? Like, we want those little babies and adults and everybody to come back to us and want to be with us. And so I don't recommend teaching that first, or bye, as a very first response. Bye-bye, get away, get the heck out of here, I don't want anything to do with you. So try to avoid those negative reinforcers as a first Mand. Okay, and then train in sequence. I think this is really important, and again, sometimes you'll see these things switched quite a bit. So for example, let me go through the list. I'll give you some examples, but generally this is a sequence. It could vary a little bit, but usually you'll start to see requests through some nonverbal indications. So I'm gesturing for that item, or maybe even pointing to that item. Next, you'll want to see Mands that are happening for items, activities, and actions with the item present. And then you go into what we call spontaneous Mands or requests, where the item's not present. Manding is occurring in the absence of the item. So I walk into the kitchen, or I'm outside and I ask for my cookie even though it's not present and I can't see it. Actions. Then you look at to stop an activity. So I don't want to do that anymore, or turn the radio down, or let's go somewhere else. And let me just go through these really quickly. I look at those items in the red as sort of some of that initial Manding response. And then later you get into things like yes and no, carrier phrases, attention, information, future events, adjectives, prepositions, which is really very refined Manding. I've been in a lot of situations where I will have a very early learner, and yes and no is being taught as a very first response. There's a whole set of things we could talk about, but you can think about some of the issues that might arise as a result of teaching yes as a first response, or as a first Mand. Same kinds of issues with not being able to respond as a listener very effectively, because you just have a little kid that's going like this. I think, Sumia, you've heard my story. You actually probably were even there. The little guy that somebody came in and said, oh, this little guy, he can ask for everything. I was so excited, so I get everything out, and he just looks up at me, it's cutest little eyes, and just starts going like this. Yes, yes, and not a very effective way for him to request. The other thing is that you have to be able to depict what the correct response is, which means figuring out where the motivation is, and so you may not necessarily know whether the man should be yes or no, because you don't know whether the child actually wants the item or not. Carrier phrases, I don't want to spend a million years talking about this, but I could. But you see a lot of situations where those are taught very, very early on, and you get this very funky language that starts to occur, like, I want go up, mom, now, please. And so essentially what a child learns is that I just put a bunch of words onto my one man because that's what gets reinforced, and they're meaningless at that point. So you'll get there, you just get there later in the repertoire. Things like attention, information, future events, adjectives, prepositions. So if I can't ask for the Skittle, I don't need to ask for the red Skittle yet. Let's focus on the Skittle, and we'll get those adjectives in there later. Good. Okay, and then setting up the environment. I think this is the final part of that planning phase, and very important to sanitize the environment if you can. So if I'm in a room with a child and there are things everywhere and all those things are extraordinarily fun, even if I have something that is also extraordinarily fun, it's going to be real hard for that motivation to be present and to be the antecedent to a man. And it may just not be there because there's competing items that are competing for my the child's motivation, the individual's motivation in the environment. I don't know why you would sanitize the environment with Purell, but I put it up there anyway as a pretty little. That's not actually, but actually that's a little confusing, isn't it? That's like I'm gonna have people going home and cleaning their rooms with Purell or something. Okay, limiting access. So again, I'm not talking about not feeding a child or anything like that, but saving items for man training opportunities. So if there's a favorite video, the child really likes to watch that video. Well, maybe we only have that video come out when we're going to work on manding, or if there's a particular snack or toy, we use those particularly for man training opportunities and restrict them during other times. Making yourself valuable. So there's a version of this presentation that really goes into talking about pairing a lot and establishing yourself as the giver of good things. But that is very important, and depending on the learner, it could look different. So I've had some learners who have such a long history of very aversive teaching procedures that I have to start by just getting them to take something from my hand, and I might not even be able to approach them very closely. I have to put the edible on the table and walk away and sort of get myself there. But the idea is make yourself a big red M&M, make yourself valuable such that the child wants to come to you to get more of the good stuff. Very important during that planning phase, and really the biggest thing that should be happening. Man training is so much easier when you have a child who's willingly approaching you, and the response effort is so low to access those things initially that it makes it a very easy interaction during your man training. And then competing or removing. I had a little guy that I worked with years ago, and his parents were lovely. They had set up this amazing area in the basement for his programming, and the dad had built this really amazing swing, and it was one of those ones you could detach it, but it came up from the, so I'd go in and I've got all the things I knew this kid liked, the Thomas the Train and the edibles, and you name it, I'm ready to go. And the kid's not coming to me. I'm thinking, well, what's going on? I've got all the good stuff. I've followed all of these procedures. Well, he's off swinging on the swing, right? He can twirl himself around and do all this crazy stuff on the swing when I'm not there. And so I asked the parents, could you just remove the swing for a little bit so I can build up the repertoire? Then I'll bring that swing back in and teach it later. But did the exact same thing with the swing removed, and now I've got this little kid who's jumping all over me and try to get my Thomas the Train. It's totally different dynamic. I was doing the same thing. It's just the environment was changed in such a way to ensure that he was adequately motivated to ask for the items that I had. Awesome. Great. And you're sure we're okay? I'm not rocking people's worlds by just continuing to talk here.
What do you mean by okay? I think everybody's getting it.
Oh, no, I meant timing-wise.
Oh, yeah.
I think I'm halfway through this presentation, and then so I should just keep going?
Yeah, and
You're-
finish in 3 minutes.
And finish in 3 minutes? You're just trying to stress me out here.
Actually, we're probably getting kind of close.
Yeah. Okay.
We have some questions, but maybe we'll do the same thing. Until after the break. Because they'll just slow down. I don't mean to make you nervous, but you have 90 seconds to finish.
I do.
No, I'm kidding.
What? You should see the look. Those of you out there, America, you should see the look on his face when he says that. Yeah, that's right. Okay. Okay. All right. So the training phase. You should teach Mands. That will go then. Well, let me talk a little bit about it then. I'm going to talk about training in the presence of the EO. I'm going to talk about minimizing other antecedents, prompts and prompt fading, and then being a giver. And being a data geek, both extraordinarily important. Being a giving data geek is even better if you can accomplish that. Okay, so very important when you're training initially to train in the presence of the EO. Again, I talked about motivating operations, establishing alterations which have a value altering and a behavior altering effects. And what that does is ensure that you have a functional man that is under the control of the appropriate antecedent, which should be the motivation. And that can give you that motivative and evocative effect. I'm going to talk a little bit about some of the things that can come into play, but some of the most common things that I'll see in man training is that there's this other wonky stimulus in there. So things like, what do you want? Oftentimes start to control responding. So you get a kid I say, what do you want? And they say candy. They take the candy. What do you want? Candy. What do you want? Candy. And you get to the fourth one and they're like still saying candy but not consuming the candy at all. That's a stimulus control problem. That's how there's motivation not present. It's almost, at that point, an introverbal. It is an introverbal, right? So I'm just answering a question. So yes, very important to ensure that motivation is the primary antecedent controlling the response. Capturing and contriving, so making sure that the teaching opportunities are initiated by the child, and that can increase the likelihood that an EO is in effect. And so that would be sort of those incidental teaching procedures or captured EOs. So a child goes to access a particular toy, and maybe you quickly sort of get in there and prompt demand, or see something through this beautiful glass door and wants to access it, and so you can quickly jump in there and get a manned opportunity. You can also contrive establishing operations, so working on actively creating a context where you know that the motivation is going to be strong. So things like having something in a box that they can't open, or giving them something salty to eat before you work on the Mands for a beverage, briefly interrupting access to a preferred item. There's a wonderful, it's a paper, right, that you wrote, Linda, on, there's a piece in there on interrupted chains. There's a book chapter on, it's a book chapter.
So it has programs.
It has actually programs for this. This is a sample of an interrupted chain procedure. So you might have a child who enjoys painting, and so you teach up a chain of, okay, I go into my art room, I get paintbrush, I get paint, I get paper, paintbrush, paint, paper, paintbrush, paint, paper. And so you teach that chain, and then you remove an item in the chain. So maybe I go in, I get paintbrush, the paint's missing, and that naturally contrives an establishing operation for the paint. You get a nice man for paint, and you can do that with all sorts of tasks and removing various items in the chain. And so you should read Linda's book chapter if you want to learn more about that. Okay. So minimizing other antecedents. So oftentimes, again, I mentioned a lot of times what you'll see with man training is this faulty stimulus control. A lot of that comes with putting different antecedents in into your teaching procedures that then come to control responding. So doing things like, what do you want? Or always having the particular item present and always there. Now that's common in early man training for the item to be present, but at some point that item needs to get faded out and the responding needs to happen completely under the motivation. Okay, so these are some faulty or other sources of stimulus control. You could have some tact prompts present. You certainly can have a question, so what do you want? Or even I've seen some things like instructions embedded in there, like you need to use your words, and the child says cookie, and then you realize what you've trained up is an answer to you need to use your words, and it's an interverbal, not contrived by motivation in any way. Echoic prompts, so you might have a situation where you're embedding, maybe the motivation is present, you get it there, but you're always giving that, say cookie, say pretzel, say swing, and the child is echoing that response, and you have an echoic that's not at all under control of MO, it's just child's echoing what you just said, which can be problematic. Okay, or no EO control at all. So like that situation I talked with the little girl, how we're chasing her around, trying to get her to ask for bubbles. I would say, I don't know what you all have experienced, but that's probably one of the most common things I come into contact with is that there's no EO control at all. So folks are just trying to teach something that the child's not motivated for, and so it just never comes under appropriate stimulus control, and you don't have a manned repertoire. Good. Everybody also needs a fat cat in their presentation somewhere. Cute babies, fat cats, and Purell. Okay, so this is just summarizing what a sample man trial looks like. So ideally, the instructor has access to the item. Access to the item is available through you and you only. So I can't just go over to the other side of the room and access that thing. Child approaches you willingly or individual approaches you willingly, and you provide enough of the item, but not so much as to satiate them, right? Because you want this to happen multiple times. So if you ask for a Snickers bar and I give you the whole Snickers bar, then we're probably done for the day. Okay, so prompts and prompts fading. Ensure you're using errorless teaching procedures. This is extraordinarily important. You do not want a child early on hearing the no, 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 no that we talked about earlier, or not being successful because the prompt does not help control responding. And so they should be errorless, the response should be effortless, and you can fade your prompts out from there. It decreases the likelihood of prompt dependency if you're using errorless teaching procedures. You can use time delay procedures as well. Those are real effective in getting your prompts out. If it's not errorless, one thing that's really important is that you're creating a very fertile ground for problem behavior to develop. So if I really want that thing that you have, and we're going through least to most prompting hierarchy, or there are multiple prompts embedded in that maybe aren't controlling my responding just yet, I'm going to be more likely to engage in behaviors that have produced that item in the past, and some of those behaviors might be kicking you in the face and tipping the trash can over, throwing a nutsy. Is that right? A nutty. A nutty. Good. Also be a giver. So I always like to tell people to ask the following questions. Is there a way for me to have the learner continue coming back to me to get more of the item? Can I prepare ahead of time to ensure the learner has to go through me to access the preferred items? Can I change the activity in such a way that it's more fun with me than without me? So, maybe that swing is really cool, but if I'm the person pushing you on the swing, it can go 5 feet higher than it could without me, then now I'm a valuable part of that interaction, and that activity is more valuable, and so I now have a manned opportunity. Okay, and can I make myself a critical component? So, the learner needs you to access that item. So maybe there's a complex part of a book that has music associated with it, and the child doesn't know how to operate that part of it. And so now you're really required to be the person who can deliver that music, and sets up a beautiful opportunity to capitalize on that MO and ensure that you teach a manned. Okay, everybody also needs a funny guy with glasses in their presentation. Be a data geek. Make sure that your data collection system is going to guide your decision making. I'll show you a data sheet here in just a moment. But one of the things that you can be looking for when you teach when you're teaching Mands is the source of stimulus control. And again, you can actually set up your data sheet to identify the source of stimulus control. So if you have your therapists who are teaching Mands, they're identifying the antecedents, and you can quickly catch, the antecedent is always a what do you want, or it's always the item present. I need to get that out of there. So you can look at things like EO control only, all the sources of stimulus control during the trial, and of course the total number of Mands. So this is just a sample data sheet that has the ability for an individual to circle the different types of prompts that are given and the type of training. You can also have in there the most common antecedents that you're seeing, and graph those and look at them and use them to capture any funky stimulus control issues that you see. Okay, I'm going to get in the maintenance phase, or I'm not.
Do it.
Okay. Good. Okay. Okay, so I'm just going to talk briefly about consistency, building the repertoire, and problem solving. And actually, I'm near the end. I think we'll be okay. So let me talk about problem solving. One of the most common things that can happen when you are teaching Mands and the child's not acquiring them and you're trying to figure out what's going on. Again, as I mentioned, motivational factors are huge. So if you are running a program or you go into a program and you're not seeing acquisition, look at motivational issues. And there are so many different things that could be happening. There could be a period of satiation that has occurred. The child has just had a lot of that item, or maybe grandma is in the back alley giving a bunch of pretzels before your session, and then you get there and you didn't know that they were totally satiated. Or it could be that it's just there hasn't been a preference assessment conducted, and so you just got some verbal report from the parent that, oh, hey, he really likes Thomas the Train, and guess what? He didn't really like Thomas the Train. He's just not motivated by it. So look at, before you ditch Manding altogether, or totally look at motivational factors and see what might be going on. These are the two most common things. If somebody's not seeing acquisition in a Mand training program, I say look at motivation, and then look at proper protocol implementation, because that can be huge too. So looking at is everybody implementing the procedures correctly? Use treatment integrity data sheets and data collection to observe whether the procedure is being followed correctly. Sometimes it's just inconsistencies across the team that creates this odd behavior that's being shaped up and reinforced, and can be fixed very easily with just some team training. Response effort is huge. So quite potentially, maybe some of the things that you've chosen as a first Mand are extraordinarily effortful for whatever reason. And there might be a way to make that a little bit easier. There's a point where the response effort maybe just is not worth it, right? Like, I'm going to engage in this response for this little bit of cookie, and it's just not that valuable. So that response effort can really change the value of the item and really mess with motivation. And so look at the response effort, and it might be that it's too difficult. Maybe it involves some very fine motor movement. If it's a sign and you can work around that and make it a little easier, the word is maybe very difficult, and you can change those dynamics. Okay, intricacies of the sign or the word, as I mentioned, it could be that they're very difficult. And then consistency across people. So just, if this is the sign for candy, making sure that this is the thing that everybody is accepting and prompting, and not this or this or this or this. Those little things can really get your training to go a bit awry. Okay, so the question was on scrolling. And this is a common occurrence. I'm going to talk about it in the context of sign language and vocal responding. But essentially what happens is you get this generalization response where I ask for car. Maybe I acquired the Mand for car, and now everything is a car. Right, so I see the cookie and I sign car. I see, want the door to be open and I sign car. It's a very common occurrence. It happens, and unfortunately, it's the reason why a lot of people will say, "Oh, see that doesn't work. That Mand training thing doesn't work, or that sign language doesn't work." But essentially, what's happened is just that responding has been reinforced, and there's a very easy way to fix it. And what you do really is going to influence whether the child continues to scroll or not. And so, not the child's fault. It has nothing to do with whether they can learn it or not. They're just not able to, or that kind of thing. But essentially, it's a very easy procedure. You just put the child's, do what's called breaking the scroll. So you put the child's hands down for a brief moment, wait a second or two, and then use errorless teaching to teach the correct response. And if you are privy to those types of errors occurring, you can also be right there at the beginning of the Mands trial to make sure that they don't happen in the first place. But it's a very simple, brief break, and then prompts to get the correct response that can fix any scrolling that happens. Vocal language can, sign language, sign language or scrolling can happen with vocal language too. It's essentially the same thing. You get, a child that motivation is present for the cookie, and you get cookie, cheeseburger, French fries, Pepsi. You get all these responses in one until they get that correct response. And essentially what's happened is that, again, that's just been reinforced. Like, I go through my repertoire of all these words that I've learned, and when I get to the right one, it gets reinforced. There's a couple ways you can handle it. One is you can wait for a natural break in the vocal scroll and then prompt the correct response. And the other thing is that if you're privy to this happening, you can, right from the get-go, make sure your procedures are errorless. So I've got this item cookie, and make sure that you don't get into that vocal scrolling to begin with. Okay, and then consistency, so across people, prompt levels, accepting, shaping, and approximation. So again, you just want to make sure that you can have the same types of prompts. Everybody's accepting the same thing. I've done this through creating books of what signs look like, or writing out the very specific vocal response that you're looking for, so everybody's accepting and prompting the same thing. But this is an area that can really mess with acquisition and make it such that the Mands repertoire is not growing at a rate that it should be and cause problems. Okay, so you've taught all these Mands, you've problem solved, you've gotten there. The next step is really just to build the repertoire. And these are some ways to really think about building the repertoire. You want to have clear mastery criteria. And mastery criteria that likely involves stimulus control issues, right? So something is not mastered unless it's happening under the appropriate antecedent stimulus control. Certainly a plan for maintenance and regular incorporation back into the training and repertoire. I recommend when you are thinking about new targets, so usually people will get real excited about Mands training and they'll want to teach 3,000 things at once because it's so fun and the child really likes it, and that's good, but you'll want to have a limit to that. You'll want to teach and then build. So I recommend people just keep a running log of all the things the kid is interested in and use that going forward. So once a child has acquired 5 Mands, okay, now we've got this log, and Johnny was here yesterday and Johnny realized that he really loves a toy grasshopper, and so that's going to be our next Mand opportunity. Collaborate with one another, so talk to people who are with the child in different environments where the child may have access to different stimuli and things that may be really interesting, so you can really capitalize on that motivation. And get creative. I have the tissue box on here because I worked with a therapist once who realized that the child somehow just thought sneezing was this hilarious thing and was really motivated to have people sneeze. And so she created like 3 or 4 Mands opportunities around tissues, right? And got him to, pull the tissue, that was a Mand, and put her head back and then do the achoo, and it was really cool. So get creative. You can do that. Assess the modality regularly, and that's primarily important for when you're thinking about going from sign to vocal or pictures to vocal or any other alternative communication system to vocal. And there's a point at which it's time, you're ready to go into vocal responding, but it's a sensitive decision. And I can talk a little bit more about that later today, but during the next presentation. But there is a point where you'll want to switch. If the child has a strong enough echoic repertoire or builds one, you gotta get that kid vocalizing as soon as possible. Okay, so it's more than just the planning phase, right? These are all intertwined, and so what you do in that initial planning phase can really influence the other phases, and they're all very much so interconnected. Okay, that wasn't 90 seconds, but yeah. Okay, good. So what should we do? Should I take questions now, or should we take a break maybe for people who have to?
I think we